Reported cases and our estimated infections are decreasing in the United States, and we project this trend will continue all the way till next winter. Our long-term projections for the United States show a rise in cases next winter, but a small bump in some states, similar to what we are seeing right now in Europe. But in general, in the US, we project a decline that will continue all the way to next winter. What we need to do in the United States is to remain vigilant, of course. COVID-19 is not over. The pandemic phase of it is over. We need to be very careful, especially if we have a risk factor or immunocompromised. FDA has approved a forced dose for people who are above 50. It's very important for all of us who are above 50, including myself, to go and get number 4. It will help a lot in reducing hospitalizations and mortality, especially if you have received your 3rd dose or your 2nd dose more than 5 months ago. As far as what's happening in Europe, we know that the 2nd wave in Europe after the peak of Omicron was due to BA2 spreading, change of behavior and waning immunity, of course. In the United States, because we have higher infection compared to Europe, and for example, compared to the UK, we have lower vaccination but more infections. The combination of the two, we have more immunity in the United States, especially in southern states where they had more infections than what we have seen in the UK. So we will not expect a big bump in the US, very minor one in some states, but a decline. What the US needs to do, of course, is to secure more antiviral medications and keep it and distribute it right now to places just ahead of a next surge, and make sure we have a plan for distribution based on risk factors and the aging of the population in each location, but also to have a plan for redistribution in case we have a waves in one state and we have medication sitting in a warehouse in another state. So shifting resources is very important as part of the preparedness. We believe that before winter, because of waning immunity, another shot may be needed as well, depending on people who they have received 4 or 3 doses. Still in the US, vaccination is not increasing, and unfortunately we have leveled at about 65% at the national level. CDC has announced that it's okay to get on a cruise ship. I believe it's safe, in my opinion, if you are vaccinated and boosted, and now if you are above 50 getting the 4th dose. But of course, for all of us, whatever we do from now on has to be based on our own personal risk and the risk of people who we live with or we are around. So basically, for somebody who's young and healthy, the risk is very minimal to get Omicron or BA2. But for somebody who's older in age, has risk factor or immunocompromised, the risk is much higher. And of course, we have to behave accordingly to protect ourselves and the people we live with and we care about. That's very important. As far as for global, what we are seeing right now in Europe, in many countries, the peak has happened, and the 2nd peak, and it started to come down. The UK, for example, still going up in France as of today. It's coming down in Netherlands. So in many European countries, that peak, 2nd peak, was about 3 to 4 weeks and came down. And driven mainly, again, by BA2 and the change of behavior. In Europe, they had more mandates than we did here in the United States, and then was a sudden change of behavior, more so than some states here in the United States where we didn't have any mandates. Florida, for example. So basically, the behavioral change that has happened after the peak of Omicron is minimal in the United States compared, for example, to what we have seen in Europe, in many countries in Europe. China is the country that we are keeping an eye on right now. China so far has been able to contain the spread of Omicron in Beijing by lockdown and massive testing. Whether they will be able to do so and maintain that control in Shanghai and in other large cities right now is a big question mark. Because BA2 and Omicron and BA1 are more infectious, we believe that chances of containing the spread of Omicron in China will be very limited. Our long-term projections in China show that they will have a major surge coming up with a peak in May towards the end of May, and a large number of hospitalizations and mortality. For several reasons. China, although has a high vaccination rate, but their vaccine is not as effective as the vaccines we are using here in the United States or in European countries. So what China needs to do is, of course, and we know they have right now received a permit to produce mRNA vaccines from Pfizer, and they have their own mRNA vaccine being developed right now. So producing more vaccine and vaccinating people, especially the elderly in China, because we know there are reports that vaccination among the elderly in China is very low compared to what we know and what we have seen in other countries. Second is to produce more antiviral, and we know that they have right now licenses to produce the antiviral medication and distribute it in China. Prepare their hospital for the surge. It's very important right now. Vaccine donations have saved a lot of lives all over the world, and countries have been generous of providing extra doses of vaccines to others who need it. It's very important to remember as you donate these vaccines to make sure they have a long shelf life. They shouldn't be about to expire, because once you give a vaccine to a country, there are a lot of logistics and distributions and manpower that's needed to administer these vaccines. Indonesia, for example, has asked all donors, please, when you give us a vaccine, let's make sure it has a long shelf life. We need to keep that in mind and not waste vaccine. And thank you everybody for donating the vaccine, but let's make sure these vaccines can be used by the country who is receiving them in time before they expire.